Today we're talking about preoperative anxiety management, and it is important to manage a patient's preoperative anxiety because high levels of preoperative patient anxiety can negatively affect the patient in a multitude of ways. Anxiety can cause increased levels of cortisol secretion, leading to psychoendocrine effects that lengthen and complicate postoperative recovery, and delay wound healing, leading to both costly readmissions and a negative impact on the patient's quality of life. In children, preoperative anxiety is linked with a higher incidence of emergence delirium, which can affect their sleep and behavior post-op. And here's a more comprehensive list of the negative effects of preoperative anxiety. So, what can contribute to preoperative anxiety? Women have been shown to have higher degrees of preoperative anxiety, and those who believe that their subjective health status is poor have more anxiety than those who believe that they are in subjective good health. Patients with a high degree of sensory impairments, such as advanced hearing or vision loss, are shown to have more preoperative anxiety. This is especially prevalent in the elderly as their senses may start to decline. Fear plays an important role in contributing to patients' preoperative anxiety. Patients may have a fear of anesthesia or being put under, a fear of pain after their surgery, and patients who may have lost a sense of control or lost a sense of their personal identity due to their disease process are also at a higher risk to develop preoperative anxiety.
There are screening tools that can be used in order to assess the preoperative anxiety to help guide techniques to use to help manage pre-op anxiety. The State Trait Anxiety Inventory is a 40-item questionnaire that is subdivided into 20 items to assess trait anxiety and 20 items to assess state anxiety. This is used to assess someone's personality, where the state anxiety is used more as an emotional response for being in an unpleasant situation. The State Trait Anxiety Inventory, while thorough, can take a long time for patients to fill out. The Amsterdam Preoperative Anxiety and Information Scale is a quick 6-item questionnaire that can be used quickly to assess a patient's anxiety in the preoperative setting. While we have pharmacological ways to help encourage relaxation, there are plenty of effective non-pharmacological techniques to encourage relaxation and the reduction of pre-op anxiety. Preoperative anxiety can be reduced by playing music to help relax the patient. A 2009 study showed that playing relaxing music for the patient preoperatively can be more effective than oral midazolam in reducing a patient's preoperative anxiety. Relaxing music can be encouraged to be played in the preoperative area, allowing the patient to use headphones to listen to relaxing music while they're in the preoperative area. Providing adequate education to the patient can also help reduce their anxiety, and educational programs make what is the unknown for the patient seem familiar. One-on-one patient education with descriptions of the preoperative, perioperative, and postoperative phases along with the surgical procedure can help familiarize the patient with their procedure. Answering common questions about the patient's surgical procedure can help reduce anxiety about their upcoming surgery. Using teaching techniques such as teaching at a 4th grade reading level and using active teachback can help ensure the patient understands the education they are receiving.
Remember, humans need personal connection. A 2021 study compared the preoperative anxiety levels of 3 groups of patients. One group received IV midazolam in pre-op, a second group received conversation and handholding in pre-op, and a third group received a combination of IV midazolam with conversation and handholding. While the third group had the lowest anxiety scores using measures like heart rate, blood pressure, and the Amsterdam Preoperative Anxiety and Information Scale, the group that received just handholding and conversation also had significantly lower anxiety in the pre-op setting. The only group shown to not have a significant improvement in anxiety levels was the pure pharmacological intervention of receiving IV midazolam alone. A systematic review of 20 studies demonstrated that aromatherapy can be an effective tool to reduce preoperative anxiety. Although massage and oral administration were found to be effective, inhalation seemed to be the most recommended intervention for a clinical setting, as it is practical and can be completed in a short amount of time. Citrus, rose, and lavender oils were most commonly used. Pediatrics can be an especially challenging population to work with when it comes to managing pre-op anxiety. Up to 60% of children suffer significant pre-op anxiety before their surgery. If the facility has access to a child life specialist, you can encourage them to come see the patient before surgery and be a part of the child's care team. Child life specialists help educate the child by role-playing, expectation setting, and teaching coping strategies. A 2020 study showed that children who engaged in at least 15 minutes of child life preparation had a statistically significant effect on reducing pre-op anxiety prior to the IV induction of anesthesia. And here are references. Thank you.